Hi there. What I wanted to do with this short video is go over the anatomical terms that you'll need for A&P. Really, the best way to learn these is to just sit down and just start learning them using flashcards or pictures or whatever works best for you. And this video is to help you push forward along that path. I'm really hoping that after just watching this video for a little bit, you will have most of your major terms down pat. And then you can go back and replay it or look at different parts of it. And if you think it's helpful, I can put the slide presentation up on Canvas. Just let me know. So the first thing that I want to do is begin with anatomical position. And it's really important to think of this. And I know that it might look pretty simple when you start off, but when you're actually sitting in an exam and you have to try and put these together, or you're in the lab and you've got your cat or whatever specimen it is facing you, it really helps to sort of keep this picture in mind, right? And I myself, I even have to look at my own body sometimes, because it's not just referring to the picture or the full organism, but it's also referring to the orientation of the organs themselves. And then you really have to really put this together. So basically all this means is the specimen or the person is looking at you face on with the palms forward, all right? And using this, that is how all these other anatomical terms are put into play in reference to each other. The other term for this anatomical position is referred to as the prone position. Now, I don't want you to be intimidated at all by all these terms, all right? And you'll be amazed at how quickly you're going to pick these up. And after this video, in which I'm going to use the major terms, you will be well on your way to knowing these. So I suggest listening to the video, then go back, look at this picture, and realize how much you've learned, all right? So don't be intimidated at all by this, all right? So let's get into these actual terms. So the first thing is directional terms, all right? So, and again, this might seem pretty basic. Superior being towards the top, towards the head, above something else, and inferior being below, bottom, or away from the head, okay? So again, when you're looking at the whole organism, this makes a lot of sense. But then when you start looking at organs, right? So you can say the liver is inferior to the lungs, for example, all right? So when you're looking at organs, it might not be as intuitive until you got all your positioning down pat, all right? But it doesn't necessarily just have to be for the full organism. Now, anterior refers to the front, all right, when you're dealing with a human, all right? So front, and posterior is towards the back, all right? Now, these terms also go by ventral and dorsal, all right? And if you're one of my students who want to become a veterinarian, you're mostly going to be using those two terms, right? So think of it this way, okay? So here, human is a biped. Now, think of a quadruped now. So we've got a cat, for example. So the ventral region will actually be facing the ground, okay? And the dorsal region will be facing the top of the room, for example. So it's a slightly different way of thinking about it, but still the same kind of terminology, all right? So you've got anterior or ventral, posterior or dorsal. I like thinking of the dorsal fin on a dolphin, for example, sometimes, all right, towards the back. Now, directional terms also include medial, which means towards the midline, okay? The midline is running through here, through the sternum, for example. You can think of it that way. We'll get into exactly what cut this is shortly. Lateral is going to be away from there, all right? So it doesn't have to be all the way here at the tips of the fingers, all right? I mean, even the shoulder is going to be lateral to the sternum, for example. And then anything in between, such as the clavicle, is going to be intermediate to that. So between medial and lateral, okay? So again, you have to think about it not only in terms of the full organism, but also in terms of parts in relation to others, okay? Now, proximal is always referring towards what we call the origination, all right? So the origin of something, all right? It's kind of a weird term. For now, just think of it as being closer to the midline, which usually is, not always, but usually, and distal would be farther from the origination, all right? Now, where these terms origin really will become useful is when you're thinking about your muscles. So there's the origin and the attachment of your muscles, or the origin and the insertion. Okay, so for now, just think of the origination as being closer towards the center of the body, or closer to midline, for example, all right? As it's drawn here, so proximal versus distal, all right? Now, ipsilateral is referring to things on the same side of the body, as you can see this in this picture here, the arm and this leg, and contralateral would be opposite sides of the body, all right? Next is superficial. Superficial refers towards the surface versus deep, which is towards the core of the body, all right? Now, again, don't fall into the trap of thinking that things inside here can't have a superficial and a deep, right? So you can have the superficial part of the heart and the deep part of the heart, okay? But usually deep, you think of it being towards the core and the other towards the surface. Conversely, also skin, you think of skin as being superficial to most things, but when we look at the layers of skin, such as the dermis and the epidermis, there's going to be layers that are going to be more superficial and deeper, all right? So again, it doesn't just refer to the full organism. Now, visceral, we're going to really get into that when we talk about our serous membranes, but visceral refers to the covering of an organ. So it's something that's actually attached to the organ, and parietal would be the covering that's attached to the cavity wall, all right? So there's going to be a lining over the lung here, which is called the visceral lining, and there's going to be another lining out here, which is the parietal lining, all right? And we'll talk about what those linings are called very shortly. Now, in regional names, I'm sure you already know cranial. You've already got that one in your toolkit. So when you think cranial, refers to the skull. Cervical, in anatomical terms, is referring to the neck region, all right? So don't get confused with the cervix, right? We will talk about the cervix very specifically when we do reproduction, obviously. But usually when you're talking about cervical, you're talking about the cervical vertebrae and the neck, all right? Now, cubital, you might not know this one, but that refers to the elbow, right? So you can try and think of your elbow as like a little cube somehow. That's sort of a way of thinking of it, because it sort of sticks out from your arm when you bend your arm. That might help. Carpal, if you think of carpal tunnel syndrome, usually is affecting the wrist, right? Or always is affecting the wrist. And that would be your carpal region. Patellar is referring to the knee, very specifically the front of the knee. Orbital is referring to the eye, or anything in the eye region and the eye socket, all right? The other one would be thoracic, which is referring to the chest region. And inguinal is referring to the groin region. Metacarpal, all right? This is referring to the hand or the palm, and you're going to have your metacarpal bones. And the plantar is referring to the sole of the foot. So you can think of the sole of your foot planting you firmly on the ground. So that's the best way to remember that. Buccal, you might not know this term, but this is referring to the cheeks. And I always remember it because it sounds kind of cute, and we always like big cheeks on a baby, for example. And that's sort of B. Axillary is referring to the armpit, all right? Femoral, you'll probably get really quick. Femoral, your femur is in your thigh. Femoral artery is running down through that region as well, all right? Now, gluteal, you probably know that one already. That's referring to your buttock, and your glutes are there, of course, your gluteal muscles. Tarsals, as opposed to carpals. Tarsal is referring to your ankle, okay? And if you get confused, you can think of tarsals, start with T, and they're closer to the toes versus the carpal, which is in the wrist. So you've got your tarsal bones in there. And the last terms, digital or phalangeal, are interchangeable for the toes and the fingers, all right? It could refer to either. So your digits or your phalanges and your phalangeal bones, all right? That will help you remember that. And now we're going to talk about the planes, all right? So next part of these body planes that are completely imaginary, all right, but very useful, especially in imaging. And I'm going to go through each of these in more detail, but to start, we'll say that sagittal is any cut that divides the body into right and left sides. Transverse or horizontal cuts, dividing the body top to bottom. And frontal is dividing the body front and back. And I'll explain a bit more, a little bit more about this coronal idea shortly. Okay, so sagittal planes, again, right and left halves. And there's one plane that's called the mid-sagittal plane, which runs right down the middle of the body, dividing the body into mirror images or mirror halves. And you know, of course, your body isn't a perfect mirror image, but you get the idea. Now, all of the other sagittal planes are called parasagittal. All right, so, and there is theoretically an infinite number of these planes depending on how thin you cut them on either side of mid-sagittal. Now, the frontal or coronal plane, all right, so this is dividing the body into front and back, all right. Now, when you are referring to a human, that's pretty straightforward, front and back. They bring in the coronal when you're talking about animals. In this case, if you have a quadruped, again, you have the crown, a sort of like a crown if you do a section through the head, all right? But with a human, which we're dealing about here in A&P, front and back. Now, the transverse planes, all right, these are the ones that divide the body into upper and lower regions of the human. And again, it doesn't matter where you're making that cut, but it's going to be a horizontal cut. And it will also, again, with all of these planes, refer to cuts across organs, all right? Now, any other plane, all right, any other one, such as this one here, is referred to as oblique. And again, it can be cutting the body or the organ, and they are cuts that are none of the other three. So those would be oblique cuts. So here's where what I mentioned we were talking about organs, all right? So here, if you're doing a cut through the brain, and this is very common in imaging, and you get different types of information depending on this cut. And a mid-sagittal cut through the brain is actually the best one to see all the different parts of the brain. So when you're seeing this view, it would be a mid-sagittal, so you're cutting the two halves. Frontal or coronal is typically what's done using MRI, right? And here you can see your ventricles and all these other wonderful features. It gives an idea of the flow of fluid around the brain and in the brain. The other one that you'll see is the transverse section, okay? So the top and bottom sections. MRI doesn't typically use this. It uses these bottom two. Of course, MRI can do any section that you desire, but medically it's usually these two, the frontal or the transverse ones that are looked at. Now, cavities. There are a lot of cavities in the body. There's three major ones outlined with the yellow, blue, and green here. And there's different parts to each of these, right? So the dorsal cavity being the brain and spinal cord, and the rest of them are basically ventral. But of course, those have the subdivisions of thoracic in blue and abdominopelvic in green. All right, so let's look at these in a little bit more detail. Now, this slide has a lot of information on it. I'm going to give you the take-home message, right? So here we have the cranial cavity, right? Pretty straightforward, formed by the skull. And then we have the vertebral canal, formed by the vertebrae, where the spinal cord is sitting in here. And this is stabilized, the brain and the spinal cord are stabilized by three layers of these very delicate membranes, well, not all delicate, but membranes referred to as meninges that are found within there. Then the thoracic cavity in blue, you can see here, is divided into three other parts, actually four other cavities. So there's two pleural cavities that surround each lungs. each lung, and these are actually bounded by these serous membranes that we are going to discuss. Then there's this pericardial cavity, also serous membrane, which encloses the heart. And then the mediastinum, which is sort of the central region. It includes the pericardial cavity, as well as other things. There isn't a specific membrane enclosing this. It's more of a region, as I will show you. Then abdominopelvic, there's only one serous membrane here, but there's two sort of cavities based upon the pelvis, all right? So the pelvic cavity containing all the organs that sort of rest in the pelvis, largely urinary, and reproductive, and the abdominopelvic, a bit of urinary, but largely digestive organs, all right? And the thoracic and the abdominopelvic cavities separated by the firm barrier of this diaphragm here, okay? Now, so the cranial cavity, as I said, is formed by the cranial bones. It protects the brain, all right? Vertebral canal, vertebral column is forming that, contains the spinal cord, and there are layers of meninges in both, all right? They are continuous, and we will discuss these when we get to that system. Now, the thoracic cavity formed grossly by the sternum ribs, as well as the bottom part being the diaphragm, also refers to as the chest, okay? There are many muscles here that are stabilizing this cavity. Now, it's sort of an interesting cavity because there are cavities within this cavity that are very well fixed. So the first one would be the mediastinal cavity, which is sort of in the middle. And there's no real membrane surrounding it, but you can sort of see it here with this dotted line. It's really down the middle. Now think of it again in 3 dimensions, okay? You've got your trachea in there, for example. You've got a lot of important blood vessels. You've got the esophagus. But also in that is the heart, right? Even though the heart, as you'll see, is contained within its own cavity. So it's sort of like a nesting doll idea with another cavity in a cavity. And then you have pleural cavities for each lung, all right? So these are fluid-filled, okay? So we have the right and left pleural cavities. And you can see here that we've got a membrane surrounding this, and I like you can see it here that it's a continuous membrane. This is going to be a serous membrane, which we'll talk about very shortly. Then the pericardial cavity, as I said, itself is holding within it the heart. Again, there's a fluid field. If I go back, a double membrane here, and like I said, it's located within the mediastinum. Now, if we look at it in terms of this diagram, you can see the heart here, and again, the dotted line showing you where the mediastinum is, and you can see some of the organs coming through here as well, all right? This being a transverse plane through here, you can see the lungs and the heart. Right, you can see the vertebrae, all right, posterior, anterior. Now, the abdominal pelvic cavity, again, down from the diaphragm to the groin, and if there's the abdominal wall, and again, there's going to be a serous membrane here, which we'll talk about. But what we have here is the abdominal cavity, as I said, containing largely digestive organs, but also the gallbladder, large intestine. In the pelvic cavity, again, this is sort of virtual, all right, just by nature of the physical structure of the pelvis. Okay, and again, we've got the urinary bladder and reproductive system, and of course, parts of the large intestine. Now, membranes of these cavities, all right, so the thoracic and abdominal cavities are lined by this thin, slippery, double-layered membrane called serous membranes. Now, these membranes are quite strong, right? They're not fragile membranes, right? And they're there for protection, All right, so they protect these organs. The reason that there's a fluid in between each layer is because of the friction. So you think of the serous membrane surrounding the heart. The heart is beating, it's constantly in motion. So this helps to allow for some slippage as the heart is beating so that we can have less friction. And the same thing with the pleural membranes surrounding each lung, for example. Okay, so these have two layers, and this is where this visceral and parietal comes into play. So the layer of the membrane that is attached to the organ proper is called the viscera, or the visceral membrane, and the layer that touches the cavity wall is referred to as the parietal layer, all right? And these are continuous, all right? So you can think of it, say, pretend your heart, put it your heart, your fist is your heart. This is a good size, right? And if you're pushing it into sort of a balloon has lost some air, and if you put your fist there inside of this balloon, and the part that's touching your hand or your fist is going to be the visceral layer, and the outer layer separated by that layer of air is going to be the parietal layer, which would normally be touching the cavity wall, if you can think of it that way. And instead of air, you're going to have fluid in here, all right? So it's sort of a way of thinking about it. But these layers, this serous membrane is continuous with each other, all right? If you go back to the other slides, you can see that's why they were drawn sort of as a continuous loop, all right? Now, they have particular membranes, and I know I already used this, pleural. These are the membranes, the serous membranes that are surrounding the lungs, okay? So the side that is touching the lungs is called the visceral pleural, and the one surrounding, touching the cavity, the pleural cavity, is the cavity wall is the parietal pleura, okay? Now, the pericardial, same thing. So you have the visceral pericardium, okay, so that's the pericardial serous membrane. The pericardium, the visceral side, is the one that's touching the heart proper. And we'll see when we go through the layers of the heart that this visceral pericardium goes by another name as well, but I won't do that to you yet. And then there is the parietal pericardium. And again, remember, there's fluid between each layer of this continuous membrane, all right? And then the peritoneal membrane, that's a large membrane that surrounds many of the organs within the abdominal and the abdominal pelvic cavity. And again, the visceral layer is going to be touching the organs, and the parietal peritoneum is going to be touching the cavity wall, all right? Now, on this cadaver, if it's a fresh specimen, you can actually pull these apart really neatly. In a fixed specimen, as this cadaver here, you can just sort of see that there are these membranes, but you can really see the space, okay? And in a fresh specimen, it's harder to see the space. The process of fixation causes shrinkage, and you can see them pulling from each other. But here you can see the parietal pleura and the visceral pleura here. And the same thing around the heart, okay? And then in between is the space, and normally this would be filled with sort of a slippery fluid. Now, other body cavities, we've got more, all right? They make sense when you see them. Your oral cavity, the nasal cavity we'll talk about a lot after Christmas, upper airways. Orbital cavities contain the eyeballs, nerves, and blood vessels that supply them. Then we have the middle ear cavities with the small bones. And the synovial cavities, these refer to particular types of joints. They are fluid-filled, freely movable joints, shoulder, hip, elbow, okay? These are synovial joints, all right? And we'll learn about all the different kinds of joints, but the synovial ones are the ones that contain the fluid. And you can use this slide sort of to help you sort of landmark what organs are in which cavities. Will really help you in lab, I hope. I'm not teaching you lab, but I like to try and help as much as I possibly can. And hopefully you find this useful. I kind of like it. I like the breakdown of it. It seems to be pretty straightforward to follow. All right. Now, I'd like to end off with a little discussion of these quadrants and regions. And again, you're just going to have to look at it. So there's 4 quadrants, of course, there's 4, and there's 9 regions. So it basically divides the body up around the belly button being the center here, okay? Particularly referring to the abdominal pelvic cavity, right? So if we look at the quadrants, and the names are pretty straightforward. So the right upper quadrant, the right lower quadrant, the left lower quadrant, and the left upper quadrant, right? And you can sort of begin to pay attention to what organs might be found here. Physicians in their charts, they always, most of them, the ones that I've worked with, all use the acronyms. So they'll say there's a slight pain in the RLQ, for example, depending on what the patient says. All right, it's still a big region, right? There's a lot going on in these quadrants. And this is where the tic-tac-toe grid of the 9 regions can sort of narrow things down a little bit more. These ones are a little harder to remember. I mean, if you start with umbilical region, that will probably be pretty easy. That's right in the middle of the tic-tac-toe. And then when you learn your vertebrae, you've got your lumbar vertebrae and ribs. So this would be the right and the left. Then we have the right hypochondriac region and the left hypochondriac region, and the epigastric region, which would be upper center. Then the hypo, or below stomach, gastric region. Then we have the right inguinal, or the right groin region, and the left inguinal region. All right. And if you compare these, you can sort of start to see where you can sort of localize different organs and different injuries a little bit better, depending on which quadrant or region that you're using, right? And that's sort of the summary. I hope this helps. And what you should do is go over the talk again, write yourself some cue cards, and just start using the terms in lab, right? Try to use them. I know I always fall away from it too, because we're just so used to just talking about right and left and up and down. But try to start using these terms in lab, and that will really help you get them. There's going to be a few on the first exam. Major ones. I won't ask you anything I didn't just mention here, but hopefully this will get you going. All right, and other than that, I will see you in class.